Hi there. So if you watched my video yesterday, you know that today's topic is laser hair removal. Now, laser hair removal is probably the most popular procedure performed at plastic surgery of short hills, and it's very understandable. Nobody wants to spend their valuable time shaving. For the treatment to be successful, the hair has to have pigment, so that's the most important thing. Because laser looks for pigment. Laser doesn't see blonde, gray, or red hair. So the darker, the thicker the hair, the better the result. Laser light gets absorbed by the melanin in the hair, it gets transferred into heat, and it travels down to the bottom of the hair follicle, where the hair is growing from. And the goal is to destroy that hair follicle to the point where it doesn't produce hair. No matter of the person or the area we treat, we always start with 6 treatments. That's usually the minimum. Once in a while, we'll meet some people that may require less treatments, but it's rare. Most people always need 6 treatments or more. It really depends on your age or the area being treated. Now, the treatments are spaced out every 4 to 6 weeks apart, and that's because of the hair growth cycle. Laser only works when the hair is in the first growing stage. There are 3 growth stages of the hair. The first one is called active growth stage. And in that growth stage, the root of the hair is attached to the bottom of the hair follicle. The second stage, as the hair grows, it releases itself from the bottom of the hair follicle. It sits in that stage for a while, and then the third stage, it falls out. Now, every time you come, all the hairs are in different stages, and we can't tell which hair is in which stage by looking at your skin. But we do know it takes about 4 to 6 weeks for it to change that growing cycle. So that's why you come spaced out that way. And the reason why it only works when the hair is in the first growing stage, because when the heat gets absorbed by the hair, it can actually reach the bottom of the hair follicle because the hair is attached to it to weaken or destroy it. Now, very important to understand that laser hair removal is not a permanent hair removal. It's a permanent hair reduction. If you have 85% less hair, it's considered successful results. Usually what's left is very fine, light, and it grows slow. Maintenance is needed for everybody, no matter what area you do, but it's very individual. Some people can go years without doing anything. Some people need a touch-up within 6 months after completing their first 6 initial series. That usually depends on the age of the person and on the area being treated. Usually the older the person, the longer lasting result is. If you are in your teenage years, you can expect to require more treatments and your touch-ups will be more frequent. But how often, we don't know. I just ask people, call us when you see that, the hair is growing back faster or you start seeing some new hairs coming back. So 6 treatments is the minimum. Underarms, for example, respond very well in most cases, and 6 treatments are enough. Bikini, 6 to 8, Brazilian bikini the same. Facial hair for women can be a struggle because it's a lot of times hormonal, and if it's hormonal, it's a battle. Most women are still very happy. It's life-changing for them, even if they have 50% less hair, because it also reduces the chance of hyperpigmentation that's caused from ingrown hairs. So like I said, even if they have to come more than 6 times and do maintenance, maybe every 3 or 4 months, they are still very happy and it's worth it for them. Now, there are, of course, some things to watch out for when you doing any kind of laser procedure, and most important is sun exposure. We treat people all year long, but if you are one of those people that have a boat and own a beach house and you have little kids and you're always by the pool and on the beach, in the summer, it's probably better to postpone the treatment and come in the fall. But like most people work, they're in the office during the week, they maybe go on vacation, or on the weekends maybe they'll go a little bit outside. So it's not an issue. Be smart about it, protect the area that you're treating, wear sunscreen, wear a hat, and you'll be fine. If you do get a tan, we usually ask you to wait at least a couple of weeks, as long as it's not a sunburn, we can treat you. But we do have to take the consideration of darker skin complexion, and we have to lower the energy, so it's not doing you any favors. So if you plan on starting laser hair removal, Be smart about it. Wear sunscreen. Sit in a shade. Throw a towel over the area being treated. Another thing is topical retinoids. If you're treating your face and you're using prescription retinol, you know, we usually ask you to discontinue it a week prior because they are photosensitizing. And certain medication also, we just ask you to inform us if you start any new medication, because some of them can be photosensitizing. So that's it. The treatments are usually very quick. Depends on the area. Face takes minutes. Underarms takes 2 minutes. Bikini, same 7 minutes. Legs can take, depends. Full legs can take 30 to 45 minutes. It's pretty quick. There is really no downtime. If you have a lot of thick hair, you may experience some redness, some irritation, kind of like waxing, but it's usually gone by the next day. Somebody that has very thick hair may have little tiny red bumps in the area, and that's just inflammation in the hair follicle. Again, it's usually gone by the next day. That's it. There is nothing else. Once we finish with the 6 treatments, I usually ask people, you know, call for touch-ups as needed. And like I mentioned before, it's very individual. Now, we use 2 different lasers in our practice, which I think they are gold standard. That way we can cover all skin types. We treat all skin types. So the lighter complexions are being treated with alexandrite laser, which is the gold standard for light-skinned people with finer hairs, lighter hairs. And then we have an ND-YAG laser that has long wavelengths and that's safe for dark skin. So we treat all the way to Fitzpatrick 6. Everybody's a candidate as long as your hairs have pigment in it. So I hope this was helpful. I hope I covered the most important things. If anyone has any questions or if something was unclear, please leave a comment. I will answer it for you. I hope everyone is doing well, making the most out of their time at home, and we miss you and we can't wait to see you soon. Stay safe, stay healthy, and stay home. I will see you tomorrow in my next video.